Hey guys, thanks for joining. Today I'm going to be talking about the skeletal system. To start this off, we're going to be talking about the skeletal system in its two main parts. First is the axial skeleton, which consists of your cranial bones, your facial bones, as well as your vertebrae column and your rib cage, as well as some of your pelvic bones. And we'll get further into each of those bones later. And second, we have your appendicular skeleton, which consists of your extremities, as well as your shoulder area and your hip bones, all the way down to your toes and legs. Before we get into all those intricate little details, I want to start off by talking about the function of the skeletal system. So just like all your other systems, the skeletal system does play a key role in maintaining homeostasis, but aside from that, its functions are to maintain support, facilitate movement, and protect our organs. It provides structure and protection while interacting with the muscular system. It helps with blood cell production interacting with the circulatory system. It also interacts with your nervous system when facilitating communication and control. Additionally, the skeletal system does store minerals like calcium, which are vital for other systems. Before going over all the bones in the skeletal system, I do want to talk about the skeletal system's most common major disease, which is osteoporosis. Osteoporosis is characterized by its lowering of bone mass and deterioration of bone tissue, which leads to fragile and porous bones. Now, as the condition continues, you will see that the patient is more susceptible to things like fractures, back pain, muscle weakness, stooped posture, lowering of height, things like that, because osteoporosis does take time to develop. Now, in terms of treatment for osteoporosis, there are usually two common routes a patient can take: changes to your lifestyle and the medication route. Things you can do for lifestyle modification are having a healthy diet, proper exercise, avoiding excessive smoking and drinking, as well as fall prevention, not putting yourself into dangerous situations where you could be injured or harmed. Aside from lifestyle changes, there is the medication route. Some of the commonly used medications for osteoporosis are these right here. I'll pop them up on the screen. Now, before I go over all the bones, there are a few things that are good to know about them before I begin. There are actually 5 different types of bones: the flat bone, irregular bone, sesamoid bone, long bone, and short bone. Some examples of the flat bone are the sternum and the cranial bones. Some examples of the irregular bone are the vertebrae. Some examples of the sesamoid bone is the patella, also known as the kneecap. Some examples of the long bone are the humerus and femur. And lastly, some examples of the short bone are the carpals and tarsals. And last but not least, it is time for what you've all been waiting for, the actual bones of the skeletal system. And like I said in the beginning of the video, I will be splitting this up into 2 parts, which is the parts of the skeletal system, the axial skeleton and the appendicular skeleton. So let's hop right in. Now, the axial skeleton does consist of 3 main parts: the skull, which consists of the cranium and the facial bones, as well as the vertebrae column and the rib cage. Now, to go one step further into detail, the cranial bones consist of the frontal, the parietal, occipital, the temporal, the sphenoid, and the ethmoid. Next up, the facial bones include the mandible, the maxilla, the nasal, the lacrimal, the vomer, the zygomatic, the palatine, and the inferior nasal colcha. Next up, moving on to the vertebral column, we have the cervical vertebrae, which consists of 7 vertebrae, which is in the cervical area. And next we have the thoracic vertebrae, which is in your thoracic cavity, hence the name. And then we have the lumbar vertebrae, which consists of 5 vertebrae, which is located in your lumbar region, which is your lower back. And then after that, we have the sacrum and coccyx. And last but not least, in the axial skeleton, we have the rib cage. Now, of course, the rib cage consists of the ribs, but there are actually 3 main types of ribs. We have the true ribs, which protect your vital organs, and then we have the false ribs, which are further down your ribs, and then the floating ribs, which are kind of like the extras. A part of the rib cage is also the sternum, which is the flat plate right here, which also consists of the mandible, which you can feel if you tap your chest. Now that we are all done with the axial skeleton, it is time to talk about the appendicular skeleton, which consists of your extremities, as well as your shoulders, all the way down from your hips, your legs, to your toes. First up, I'm going to start off with talking about the extremities of the appendicular skeleton. So we have our humerus down to our radius and ulna, to our carpals, metacarpals, and phalanges. I'm going to talk about our legs next because it kind of translates and you'll see where I'm talking about. We have our femur, our tibula, our fibula, as well as our tarsals and our metatarsals down to our phalanges, which is our toes. And you can see where the correlation is with our carpals, metacarpals, and phalanges. And last on the list, we have our girdles, our pectoral girdle and our pelvic girdle. Our pectoral girdle consists of our clavicle, also known as the collarbone, which is also a very commonly fractured bone, as well as our scapulas, our shoulders, and our pelvic bones, which is the iliums, as well as the pelvis and pubis bones down in our pelvic girdle. Well, there you have it, guys. That is a complete rundown of the skeletal system. I know it is very long. There are many parts to the skeletal system, but I hope you can take away something, and I hope that you learned something from this video. Thanks for watching.